We're here with EA, who's had her multifocal Ortho-K lenses for a number of weeks now. Multifocal simply means that we've changed her cornea, the front part of the eye, so that she's able to see off at a distance and up close. We're going to be making a slight modification in her left. She's attained phenomenal sight and her corneas are beautiful in her right eye, and we're going to be doing this equally in her left. But what I'd like you to do, please, is put into your own words, how has this changed your life?
So before I had the Ortho-K, I've worn glasses since I was in 4th grade. I couldn't see distance at all. So I started wearing contacts probably in high school, so I would go between my glasses and my contacts. I turned 40 last year, and when I turned 40, I couldn't see up close anymore. So I would have to either wear reading glasses with my contacts, which then I became dependent on, or I'd have to wear my glasses and take them off to be able to read. So having the Ortho-K, where I take them out in the morning and I could read and see far with nothing, has been life-changing. Because I was going around the house with my glasses, my reading glasses, my contacts, I would lose everything, and I would give myself headaches with the reading glasses, so it was not working. So definitely changed my life. So
this kind of has given you a lot of freedom.
Yes,
so absolutely. You can drive and you can work on a computer or read or do anything that you want to be able to do at both of those distances.
Yeah.
How have you worked this in, and how easy was it for you to learn how to insert and remove and clean and disinfect?
It was very easy. They showed me at the office. I took them in and out a couple of times. I went home that night, and I have my setup at home with my towel, my dining room table, with my mirror, and it's very, very, very easy. Yeah.
Would you recommend this for other people?
Yes, I have actually told people about it, and they can't believe it. They've never heard about it. Just like myself, before I came in, I never heard about it. I would absolutely recommend this.
Great.
100%.
Wonderful. Thank you so much for sharing. Is there anything else you'd like to add?
I would just add, because I have 2 children and I have genetic, I guess, eye problems in my family. For those with younger children to look into it, because for myself, my eye has gotten so bad that I'm at risk for retinal detachment, because I've worn glasses for so long. So if you can get your children to wear them at a younger age, it'll help stop that.
You're absolutely right. And we have children as young as 6 that are in Ortho-K. We've got patients that are in their 70s and everywhere in between. And yes, when we find a child that's early on and starting to become more and more nearsighted, Ortho-K is one of the best ways as a first step in starting to reshape the front part of the eye and to prevent that myopia or that nearsightedness from continuing. We call that myopia management. We can manage it, and most of our patients do phenomenally well, and they don't progress, they don't get worse.
Yeah.
And yes, we can prevent things like retinal detachment and glaucoma and cataracts and myopic maculopathy, and those are changes that become more prevalent as somebody gets older. So if we can stem this, it's kind of like changing the washer instead of having to change the entire faucet.
Right.
Great. Thanks so much for sharing.
Of course.